Hi everybody, I'm Lauren Valdis, Medical Director of Education here at SWORBHP, and I just want to say a very quick, but also very heartfelt, happy paramedic services week. Thank you for all you do, for our family, for our friends, for our neighbors. You're there for anybody at any time. With your skilled and caring heart and hands, you help people in their darkest moments. Anybody, at any stage in life, you're there for them. You make our communities better and safer. You step up when other people step back, and for that we can't thank you enough. As part of paramedic services this week, we're answering real-time questions. So without further ado, here is my question. But again, thank you so much for you do for this week, this day, and every day.
The preamble lists a convention to follow left to right when considering administration of medications via different routes. Do I always follow this? Let's say I have a patient who is hypoglycemic, but can tolerate simple oral carbohydrates. Do I give them dextrose, as that is the first drug written into this medical directive?
Okay, this is a great question because we know that there's some confusion about this because of what is written into the ALS-PCS. So let's touch on that really quickly. So within the preamble on page 11, there's verbiage under the convention/medication dosages and administration section that says, and I'm going to read it off my screen here, when more than one route of medication administration is listed, the order of preference for route of administration is left to right. There's a period there, and then this is the important part. Clinical circumstance for each case should determine the final route chosen. So that is what it says in that preamble section. So what you should take away is that the clinical circumstance for each case should determine the final route chosen. What route works best? Use that. When there's multiple treatment options, use the clinical circumstance and employ the least to most invasive treatment required. So in the example that you give with a hypoglycemic patient, if you think that they can tolerate oral hypoglycemics and treat their hypoglycemia, use that. It's the least invasive and you think it's the most clinically appropriate. However, should they be more altered and you don't think that oral glucose is the best route chosen, then use the more invasive treatments as they require. So I hope that answers that question for you. Hope it makes it as clear as possible. SWORBHP supports whatever method you think is the most clinically appropriate, although there is preference for left to right. It's only if all clinical circumstance are equal. If clinical circumstance for your patient picks a medication that's right versus left on the ALS-PCS, we would support you using the medication route that is more clinically appropriate. All right. Thanks again, everybody. And again, a heartfelt paramedic services week. Thank you so much for all you do this week, this day, and every day. Take care.